Amyotrophic Lateral Sclerosis, a brief look into this neurodegenerative disease. What is ALS? ALS, also known as Lou Gehrig's disease or motor neuron disease, is a progressive nervous system disease that affects the nerve cells in the central nervous system. It causes loss of muscle control, which can eventually have a profound impact on the muscles used for vital everyday activities. These include moving, speaking, eating, and breathing. ALS affects two groups of neurons, the lower motor neurons and the upper motor neurons. The lower motor neurons are located in the brainstem and tend to cause muscle weakness, muscle atrophy, which is shrinkage of the muscles, and muscle twitching. The upper motor neurons of the cortex give rise to the corticospinal tract that descends laterally through the lateral spinal cord. Degeneration of these neurons is responsible for spasticity, which is tightness in the muscles, slowness of movement, poor balance, and incoordination. There are three main causes for neuronal degeneration, which include disorganized immune response, chemical imbalance, and mishandling of proteins. Disorganized immune response. The immune system may attack some of the body's cells, possibly killing nerve cells. Chemical imbalance. Patients with ALS often have higher levels of glutamate accumulating around the motor neurons. Glutamate can become very toxic in high quantities, which can cause the motor neurons to die off. Mishandling of proteins. If proteins are not processed correctly by the nerve cells, then abnormal proteins can accumulate, causing the nerve cells to die off. These three factors cause motor neurons to gradually deteriorate and eventually die. When motor neurons are damaged, they stop sending efferent messages to muscles throughout the body. Risk factors of ALS. Heredity. 5 to 10% of people with ALS have inherited the disease. Age. Most common between ages 40 and the mid-60s, as risk increases with age. Gender. Before the age of 65, there are slightly more men than women, but the gender difference disappears after the age of 70. Environmental factors. Smoking and environmental toxin exposure are also risk factors of ALS. There are a variety of symptoms that come with ALS, most of which revolve around motor movement. Some of the main symptoms include difficulty walking, weakness in legs, feet, and ankles, tripping or falling, hand weakness, slurred speech or trouble swallowing, muscle cramps or twitching, and cognitive or behavioral changes. There are a variety of tests a physician can administer to diagnose ALS. An electromyogram evaluates the electrical activity of your muscles when they are at rest and when they are contracting. A nerve conduction study is able to measure a nerve's ability to send impulses to muscles. Some other tests include MRI, blood and urine samples, and a muscle biopsy. Essentially, there is no treatment for this disease, but there are a number of ways to help the patients with the complications that come along with ALS. There are two medications that are known to help slow down progression and help prevent complications. The first one is Riluzole, which has been shown to increase life expectancy, and the second is edaravone, which reduces the decline in daily motor functioning. Doctors may also prescribe other medications to help with the complications of ALS. There are therapies and aids that are used to support the patients. These include breathing care, physical therapy, occupational therapy, speech therapy, nutritional support, and social support. There have also been new advances in stem cell therapy and gene therapy as a way of treating this disease. Stem cell therapy is a promising approach as there have been recent advances pertaining to the knowledge of the molecular basis of ALS. Gene therapy may also become a treatment route as ALS has a particularly characterized genetic form. Through gene therapy, viral vectors can be used to deliver therapeutic sequences to stabilize and transduce motor neurons in the central nervous system. For patients with ALS, there are a variety of resources located throughout Nova Scotia and Canada. The ALS Society of New Brunswick and Nova Scotia offers an equipment loan program as well as support groups. The ALS Society of Canada offers support services, conducts research, and advocates for ALS. You may also be able to find a wide range of therapies and aids for ALS patients at hospitals near you. Some hospitals in the western region of Nova Scotia, as well as Halifax, include the Valley Regional Hospital, the QE2 Health Science Centre, and the Halifax Infirmary.